Welcome to the November monthly project update for the Caregiver Supports Project. The Caregiver Supports Project aims to implement a continuum of placement resources that enable safe, stable, and supported placements for children and youth in foster care. There are two phases of this work. In Phase 1, DCYF will replace the 4-level rate assessment system with a 7-level model that is based on the needs of children and youth in care. In January 2024, DCYF will implement the new 7-level model and start paying the new foster care level reimbursements for licensed caregivers. Phase 2 of the Caregiver Supports Project is the implementation of a new caregiver supports contract to provide placement supports to both licensed and unlicensed caregivers. Case aids will be part of the placement supports available for caregiver supports levels 3 through 7. The caregiver supports contracts will be awarded to providers through a bidding process, and the placement supports will be phased in starting in 2024 and implemented statewide in 2026. The supports will roll out according to an implementation plan that is based on capacity to provide services and allowed legislative project funding for the next few years. The Caregiver Supports Project is part of DCYF's Thriving Families campaign. Thriving Families is made up of multiple projects and initiatives in the child welfare space that focus on prevention, supporting families and staff, and strengthening practice. The projects, including caregiver supports, are listed on the Thriving Families website along with links to fact sheets about each project. The Caregiver Supports Project is the culmination of several years of work, including research and extensive stakeholder engagement, and gathering of input from many different groups and individuals. Today's presentation focuses on the history of the Caregiver Supports Project. A rate study completed in 2018 and 2019 found that rates were not sufficient to meet needs of caregivers caring for children with higher needs, partly because there was a big difference in BRS rates and the highest foster care level rate, leaving a gap in support. DCYF also completed an evaluation of the current foster care rate assessment tool in 2019. The current tool consists of questions related to how long caregivers spend taking care of the children and youth placed in their homes. Responses are associated with points that are added up, and each level has a range of total points. The evaluation found that most children and youth had a level 1, indicating a lack of sensitivity for the tool to distinguish between low and moderate needs, or meaning the tool could identify very high needs but could not reliably identify moderate needs between the lowest and highest level. The tool is also more sensitive to identifying externalizing behaviors that demand caregiver attention, and less sensitive to identifying internalizing behaviors which still need treatment and support but do not necessarily demand caregiver attention. This is a result of the subjective nature of using caregiver reporting of time spent caring for a child. The evaluation also highlighted the subjective nature of the tool by showing that the most significant predictor in the model was whether or not it was the same or a different caregiver providing responses for the assessment. When a child changed placements, it was more likely to see the new caregiver report a reduction in behavioral and physical needs for the child. Recognizing an opportunity to improve an outdated model, DCYF took recommendations from the rate study and the foster care rate assessment tool evaluation into conversations with different stakeholder groups to gather further feedback. With input from stakeholders, DCYF developed a proposal for the Foster Care Placement Continuum Project, which later became known as the Caregiver Supports Project. The project will be referred to as the Caregiver Supports Project throughout this presentation. The Caregiver Supports Project was undertaken to address several identified pain points in the current system. The current rate assessment process is 20 years old and needed to be reviewed and updated. The current process for rate assessment is also subjective. It's difficult to establish reliability of any tool without objectivity. Subjectivity also leads to unfair allocation of funding, with some caregivers over-reporting care needs and others under-reporting care needs. Using caregiver report of time spent caring for a child is not the best proxy for a child's actual support needs. As stated in the last slide, the main reason a child's level would change was not because of a change in needs, but because of a change in placement, so the child was with a different caregiver. This led to a less fair distribution of supports, as some caregivers reported higher needs, while a different caregiver would report lower needs for the same child. A subjective system is also much more difficult to evaluate for bias. Bias cannot be eliminated if it cannot be identified. The current process does not clearly identify a child's needs. This makes it difficult to link caregivers to the supports that are best suited for the child in their care. It also makes it difficult to develop contracted resources structured to support caregivers to meet the needs of children placed with DCYF. In a subjective system, caregivers must continuously justify their reimbursement level, whereas in a needs-based system, the reimbursements are readily available at the time of placement for the known needs. There is a substantial gap in placement resources between foster care basic and BRS, which interferes with many children receiving their actual needed level of care to be able to thrive and can lead to worsening conditions while in care. This gap creates a risk of kids failing up into more restrictive settings because supports are not available at the foster care rates, but BRS and therapeutic treatment are more intensive services that are needed for a child who could be placed in a foster home with some additional supports. There is a resource inequity because currently only licensed foster parents receive placement support. Kinship caregivers have great difficulty in accessing support resources or do not have access at all. The project has several goals that were developed to address the pain points identified in the previous slide. These include creating a transparent and data-driven payment methodology for reimbursement, which will be achieved through the new model that has been developed using data, making resources available at the time of placement because the model is based on categorized needs, identifying a range of caregiver skills and abilities that can meet needs of all foster children to be able to help caregivers develop the skills needed if they don't have them to meet the youth needs, providing caregiver resources based on needs of children and youth and being able to serve a diverse population all the way up to BRS needs, increasing placement stability by providing caregivers the right support, providing a continuous array of placement supports that collaborate with other child serving systems, creating mechanisms for evaluating resource allocation inequity and system bias to be able to effectively reduce it, clearly defining needed services and service level expectations from contracted providers, and reaching parity in resource support or creating more fairness in how dollars are allocated. There were extensive communications with many different groups to inform the caregiver supports model. Conversations about the project started long before 2023 and before the official project start in 2020. DCYF met with many stakeholders to get feedback about the model. Stakeholders included foster care alumni, DCYF staff in all regions, foster parents, including CPA licensed and state licensed foster parents, kinship caregivers, child welfare service providers, specific foster parents focus groups, including BIPOC caregivers and caregivers of youth with high needs, allied services such as public mental health services and Apple Health or coordinated care, tribal partners, the Kinship Advisory Committee, and legal child advocates, the Office of Public Defense, and the Office of the Attorney General. In 2021, a work group comprised of DCYF staff with a kinship caregiver representative, a foster parent representative, and 2 CPA staff members met regularly to develop recommendations for the project. The team went back to all of the stakeholders listed previously to share results for the work group and gather additional feedback, and also presented work group recommendations in different forums such as 1624 meetings, ICW meetings, and public meetings open to the DCYF listserv distribution. DCYF used the input from all of the stakeholders to develop an implementation plan that informs the work that is happening today. The project team includes representatives from fiscal, program, regional field operations, recruitment and retention, licensing, and the Office of Tribal Relations to ensure wide representation and more perspectives involved at the agency for a more successful implementation. As mentioned in the last slide, there were many preliminary conversations with stakeholders about the scope of this work prior to the project launching in 2020, although the official start date was January of 2020. The work group referenced in the last slide met from January to September 2021 to develop recommendations for the new model, while DCYF also met with many different groups to gather feedback about the direction of the project. RDA completed their analysis and report in December of 2021. DCYF shared the project vision and workgroup recommendations for achieving the vision to stakeholders in many different forums from January through July 2022 through targeted presentations with the intent of gathering additional input to inform the model. The decision package to fund the project was submitted to the legislature in September of 2022, and funding was approved in May of 2023. While waiting for a decision from the legislature, the project team developed implementation plans that could be followed dependent on funding. Once funding was confirmed, the project team moved forward with the implementation plans and continues this work today. Phase 1 of the project, which is replacing the current 4-level system with the new 7-level caregiver supports model and implementing new reimbursement levels for licensed foster parents, will go live January 1, 2024. One of the goals of the Caregiver Supports Project has been that the model is data-driven. To help ensure this happened, DCYF partnered early with DSHS Research and Data Analysis, also known as RDA. RDA is located within the Department of Social and Health Services and does research and evaluation projects for state agencies. They focus on using high-quality data to inform policy conversations. This slide gives additional information about RDA. DCYF contracted with RDA to research the needs of children in out-of-home care at the time of placement. The original research report looked at medical claims and administrative data for 25,638 children in DCYF care between 2015 and 2018. RDA analyzed how observed variables clustered together and identified subgroups of needs within the total population. You can view the original RDA research report at the link provided in the slide. The original model in the RDA research paper had 10 levels. RDA refined this model using more recent cohorts than the 2015 to 2018 cohort and narrowed down the indicators used. For example, the original report had separate categories defined largely by gender based on internalizing or externalizing behaviors. So these categories could be combined into a single complex mental health category because the need was mental health, but the manifestation was different. Additionally, juvenile justice involvement was excluded as an indicator because of the potential for bias. Note that substance abuse data is not included in the model because of federal privacy laws for this type of health information. After the statistical modeling was redone, the 7-level model as seen on the next page emerged. DCYF is in partnership with RDA, and there is funding to continuously evaluate the model. It is not meant to be static. RDA and DCYF will be monitoring data, and the model is meant to be updated based on findings and identified trends and patterns. The model can be refreshed over time and after additional stakeholder engagement. After years of gathering inputs, securing funding, and planning, the Caregiver Supports model as seen in this slide was developed. Phase 1 of the Caregiver Supports model will be implemented starting January 1st, 2024. Phase 1 includes new caregiver support level payments for licensed caregivers. Phase 2, which will start rolling out later in 2024, includes the implementation of placement supports for all licensed and unlicensed caregivers. For details about Phases 1 and 2 of the Caregiver Supports project, please view the August presentation video or presentation slides that are posted on the project website. You can find the links under the previous communications header at the bottom of the Caregiver Supports project website. The Caregiver Supports model includes basic foster care or Caregiver Support Level 1, as well as 6 distinct support needs categories shown on this slide. Each support needs category is associated with a Caregiver Support Level 2 through 7. The Caregiver Support Level determines the foster care rate that licensed caregivers receive starting January 1st, 2024, as well as the placement supports level of service that all caregivers, licensed and unlicensed, will receive as the Caregiver Supports contracts roll out in Phase 2. As discussed in the presentation, the Caregiver Supports model has been designed for the following: transparency, objectivity, fairness, consistency statewide, supporting the caregiver to be able to care for children and youth with diverse needs, increasing supports for unlicensed caregivers and supporting a kin-first culture, increasing foster care level payment rates, closing the gap between BRS and level payment rates, clear service level expectations and quality control for contracted providers of placement supports through standard contracts, and aligning the caregiver supports contract rates for contracted providers with the service level expectations. Please refer to the Caregiver Supports Project website for up-to-date information about the project. You can visit the DCYF rules filing site to learn more about WAC changes that are associated with the project. DCYF has posted a request for information, or RFI, to get feedback from providers who are interested in bidding for a caregiver supports contract catchment area. Responses to the RFI will help inform the final contract and procurement process. RFI details are on the website. You will see content about caregiver supports in the monthly Caregiver Connections and Thriving Family publications. There will also be another project update presentation like this posted on the website at the end of December. The project website is the best source for information about the project. Tribes will have the option to do their own rate assessments on tribally dependent children, starting with implementation of Phase 1 of the project, and will have the option to provide placement supports to their own members as Phase 2 implementation rolls out. DCYF is engaging in a formal consultation process with tribes to determine project impact and engage tribes in project implementation. Roundtables were held on November 14th and 28th, and a formal consultation will take place on December 12th from 2 to 4 p.m. For more information about the consultation or to participate, please contact the Office of Tribal Relations or Mandy Moreland. You can also contact Mandy if you would like to meet with DCYF to discuss the project and impacts to your tribe. You can view presentations specifically for tribes on the project website under the previous communications section header at the bottom of the page. If you have any questions or comments about the content in this presentation, please email the Caregiver Supports Project inbox at dcyf.caregiversupports@dcyf.wa.gov. Thank you for reviewing this presentation, and we look forward to sharing additional information next month.